My name is Dr. Patrick Henderson. I'm a cardiologist here at St. Francis Hospital with the St. Francis Heart and Vascular Institute. We offer a lot of screening exams here for cardiovascular disease. There's 5 major ones that we kind of look at between a calcium score, a screening echocardiography, a screening carotid ultrasound, what we call ankle brachial indexes, or screening for peripheral artery disease in the legs. And we also look at the abdominal aorta with ultrasounds looking for aneurysms. I think screening tests are important. I personally would like to know where I kind of stand with something and know what I can do to prevent something in the future, what I can do to fix or help something that may be a problem. And I personally like to know, like I said, where I stand with something and can either put it in the rearview mirror, kind of move on, or if there's something I got to deal with, I personally like to deal with it and then be able to know I'm working with that or trying to improve that in the future. And I'm not a big fan of surprises that I didn't know this happened, and so I will advocate for screening tests in the right patients. Somebody with a family history of premature heart disease. If you've got a parent or a sibling that's had heart disease of some fashion or vascular disease of some fashion at a young age, a screening test would be appropriate. You know, somebody in their 30s, 40s, 50s that doesn't know where they kind of stand in terms of what their genetic risks may be or where their risks may be in general of heart disease. This would be a test they may consider or a series of tests they may look at doing. So calcium score is a very specific test that we kind of look for atherosclerotic disease or plaque buildup in the arteries of the heart. This is different than the calcium that you take. Because you have an abnormal calcium score doesn't mean you can't ever take dietary or supplemental calcium again. Completely different in terms of heart disease. This is evidence of plaque or cholesterol buildup. Female or a male that's 80, 90 years old, I would expect an element of calcium in their arteries just based on natural history. But really at younger populations, knowing where you stand would be quite important. We offer an echocardiography screening exam. It's a very brief kind of screening test that looks at the size and the strength or the function of the heart. It's a good screening test to know, is my heart function strong? Is it in the normal range, or do I have a lower ejection fraction or strength of the heart? This is for the person that kind of wants to know, what does my heart look like in terms of the strength? People with weak hearts don't live as long as people with strong hearts, and that'd be something we would want to discuss. The other 3 vascular screening tests we offer is ultrasounds of the arteries in the neck or the carotid arteries. This would look for narrowing or blockage in the arteries going up to the brain or in the neck. We offer ultrasounds of what we call the abdominal aorta. Any 65 to 75-year-old male that's ever had nicotine in their life, even once, would benefit from a screening exam with an ultrasound of the abdominal aorta. And the last screening test we kind of order or offer is something called the ankle brachial index, or ABIs. This takes blood pressures in the arms, it takes blood pressures in the ankles, and it compares them. And realistically, they should be similar. If the blood pressures were lower in the ankles as compared to the arms, it might suggest something like a blockage in the arteries of the legs. At St. Francis, we offer these screening tests for what I would deem a pretty reasonable price. A lot of these are cheaper than your deductibles. You could use sometimes your flex spending account or your health care savings account to do these tests. They are a cash price without insurance. You can self-refer and go look at these yourself, and it's something that we offer really as a service to the public to be able to look for this if they're curious or to see where they stand. If you have symptoms or if you've had history of heart disease, a lot of these screening tests are not needed. If you do this test, you should get the results rather quickly, almost the same day, if not the following day, and you'll see it uploaded either on your MyChart pretty quickly or you'll see that result. If you have any relationship with a cardiologist, you should be discussing screening cardiovascular tests with your cardiologist or your primary care provider. If you have questions about whether I should do a test or not do a test or go somewhere else for a test, that's something I would certainly discuss with your cardiologist or your primary care provider, because you may not need that test and it can be somewhat costly at different places. You may not have any symptoms with some of these screening tests. The human body is pretty impressive at how well it can compensate for things, and a lot of these things you may not know about until something's happened, and in that situation now you're in more of a cleanup or a fix phase rather than a prevention phase, which is always more important. When we say an ounce of prevention is worth a pound of cure, would be important to know where you kind of stand in prevention in the future.